Good morning. My name is Stuart Walker, and I'm here to talk about Taut band therapy. I am an instructor for continuing education, and this is just a brief summary of the kind of work that I teach. The first question, obviously, is what is Taut band therapy? And to begin that discussion, we need to talk just briefly about Janet Travell. Her work, Myofascial Pain and Dysfunction, the Trigger Point Manual, is really the cornerstone of the work that many of us have been doing regarding trigger point therapy. And Janet Travell was John Kennedy's back guy. Under his administration, she was the White House physician, and also under Lyndon Johnson's administration. She pretty much single-handedly brought this notion of trigger points and sore attachment sites and taut bands into legitimate scientific inquiry. In the briefest summary, she really emphasized that the way to normalize these aberrant tissues, these tight knots, these streaks of tension in the muscle, was to slowly lengthen it. And that, however, as she explains in great detail, is not that easy, because by definition, when you have a serious trigger point, say here in the bicep muscle, you cannot just easily lengthen it. You run into some discomfort at one range of motion. If you try to stretch it beyond that, it becomes painful. If you go beyond that, you will get an involuntary contraction, which of course is counterproductive to the goal of lengthening. So really the third principle is that you want to find some way to get in there and to lengthen the tissues without causing that involuntary contraction. There are a lot of different ways to do this, and one of them is to work very slowly so that you are getting underneath that pain threshold, so you're not setting off the alarms, as it were. Another way is to work with the band itself. The taut band in the muscle is a streak of tension that is palpable. You can feel this streak of tension, and it's important because it's in this streak of tension, in this taut band, that the trigger point is embedded, and at the end of this streak of tension, the sore attachments are found. So the taut band is really an important part of the treatment of trigger points.